Hello, it's Dr. Steve Weiner from the Aesthetic Clinique in Santa Rosa Beach, Florida. And I'm going to show you my technique for enhancing a younger jawline using my reJAWvenation technique. So I use the Easy Guide system from Softfill to insert the cannula, which is 22 gauge and 50 millimeters. I'm using Lyft here, Restylane Lyft, which has a very high G prime. I rotate the syringe so the injection port is pointed downward. I insert the cannula all the way to the gonial angle in the subcutaneous plane, which is superficial to the platysma. At the gonial angle, I start injecting in a retrograde technique. I inject more towards the gonial angle and less towards the injection port. I call this my tadpole technique. I do the same to the opposite side. I insert the cannula all the way to the gonial angle, and then I do retrograde injections. What I'm trying to achieve with the filler is a more distinct gonial angle and inferior border of the jawline. Using this technique with cannulas, the patient should have minimal downtime, minimal swelling, and minimal discomfort. Using this subcutaneous plane, you have much more efficient use of the filler. When the injection is complete, there is a little massaging and molding of the filler to get the perfect result. We are now moving on to lip enhancement in the same patient. This is in real time. I'm using a tenting technique. It's also called a fencing technique or a Russian technique. And it's a vertical, small depots from the vermilion border down to the wet-dry junction of the lip. You see there's a little bit of filler left on the vermilion border, and that technique allows for additional hemostasis and a very distinct vermilion border. This was taught to me by the famous Amsterdam doctor Tom van Eyck. I pay special attention to injecting the Cupid's bow. I then wipe the upper lip and proceed to the injection for the lower lip. This is done in the submucosal plane as well. It's between the wet-dry junction and the vermilion border. I do not inject all the way laterally in the lower lip. I keep the injections in the medial 2/3 of the lip. I continue the injection in the upper left lip using the fencing technique again. This starts in the vermilion border and goes down to the wet-dry junction, and I do this retrograde technique. If there is an M-shaped deformity, I will inject a little more towards the wet-dry border and less as I come up to the vermilion border. The advantage of using the fencing technique over the fanning technique is that it gives a more distinct vermilion border and you get more enhancement with the same amount of product. I am now giving support to the commissures with a pillar technique. Keep in mind that the facial artery is between 1.2 and 1.5 centimeters away from the commissure. I am now doing the happy face correction, which is in the Marionette area. I'm using a 25 gauge 40 millimeter soft fill cannula with the Easy Guide system. And at first I do a subcision of the ligament that goes from the DAO muscle to the skin, which is called the labial mandibular ligament. By subcising this ligament, you release the strain on the Marionette area. I then place the thin thread of expression technology filler, which in this case is Kysse, to support this area. You will note that the port is facing towards the skin, so it is in the subcutaneous plane. Here I'm doing the same to the opposite side. I'm first subcising that labial mandibular ligament, and then I'm laying a little thread of the Kysse filler between the skin and the DAO muscle. In some patients, this ligament is fairly robust, and in most patients, it is thicker towards the oral commissure than it is towards the jawline. This happy face technique was developed by Frank Rosengaus from Mexico. He's a facial plastic surgeon. There might be some bruising associated with this subcision, and there might be some swelling. You will note that I also place a little bit of filler in the corner of the mouth to support the commissures as well. The other fillers I use for this area are Restylane Refine and Define.